Okay, this is the Cohort 7 Horse Heavens Hills Section 35 for Team Columbia. We are Team Evergreen, and this is our presentation on what is epidemiology. The definition of epidemiology is the study of the distribution and determinants of health-related states and events in specified populations. It is also the application of this study to the control of health problems. The historical evolution of epidemiology. Epidemiology emerged as a formal science in the 19th century, unfolding as a discipline since World War II, but dates further back than that to the time of Hippocrates, traditionally known as the father of modern medicine, making it nearly 2,500 years old. Going into the history a little bit more in depth, in 400 BC, Hippocrates, known as the father of modern medicine, is presumed to have written the Epidemics and On Airs, Waters, and Places in 400 BC. This marks the first attempt at finding natural causes for diseases regarding the health of whole populations of people in different regions of the world, thus suggesting that environmental and host factors such as behaviors might influence the development of disease. In the 17th century, specifically 1662, the London-based councilman John Grant was the first person to analyze the Bills of Morality, which recorded the weekly counts of christenings and deaths in London. He published the results of his findings in Natural and Political Observations made upon the Bills of Morality. He also constructed the first life table, a statistical table that uses mortality rates of a group to determine their average life expectancy. In the 18th century, Surgeon Edward Jenner observed that people who develop cowpox, a mild disease, never contracted smallpox, a more severe disease. He tested his observation using matter from the cowpox lesion on a dairymaid's hand to inoculate a young boy against smallpox, which became one of the most widely known vaccination trials for smallpox. Again, in the 18th century, Scottish surgeon James Lind added to the foundations of epidemiology through his studies of scurvy by conducting the first controlled medical trial. His findings influenced the British Navy to make lime juice a compulsory part of sailors' diets, resulting in the eradication of scurvy in the British Navy. William Farr, the father of modern vital statistics and surveillance, continued Grant's work by systematically collecting and analyzing British vital statistics, reporting to health authorities and to the general public. His most important contribution was the establishment of a sophisticated system for classifying the causes of death, enabling the comparison for the first time of mortality rates between different demographic and occupational groups. Farr's classification system was the foundation for the International Classification of Diseases, or ICD, used to classify causes of death and injury. In 1854, anesthesiologist John Snow was conducting a series of investigations in London, warranting his being considered father of field epidemiology. This study established the sequence of steps used by current-day epidemiologists to investigate outbreaks of disease. Based on a characterization of the cases and population at risk by time, place, and person, Snow developed a testable hypothesis. A little bit more about John Snow. 20 years before the development of the microscope, Snow conducted studies of cholera outbreaks, both to discover the cause of disease and to prevent its recurrence. At the time, it was assumed that cholera was airborne. He began his investigation by determining where in this area persons with cholera lived and worked. Plotting cases of cholera on a map of the area, Snow was able to identify a water pump in now Broadwick Street, as the source of the disease. he had the handle of the pump removed, and cases of cholera immediately began to diminish. The map on the right spots the deaths from cholera in Golden Square area in 1854. This is a redrawing. Snow's second investigation re-examined data from the 1854 cholera outbreak in London. He had noted that districts with the highest death rates were serviced by two water companies, the Lambeth Company and the Southwark and Vauxhall Company. To avoid contamination by London sewage, the Lambeth Company moved its intake water works to a site on the Thames well upstream from London in 1852. Over a 7-week period during the summer of 1854, Snow compared cholera mortality among districts that received water from one or the other or both water companies. The results are shown on the table to the right. As you can see, the Southwark and Vauxhall Company contributed most to the number of deaths from cholera. Snow went on to identify that the water supply company for every house in which a death from cholera had occurred during the 7-week period, thus establishing the sequence of steps used by current-day epidemiologists to investigate the outbreaks of disease. And then his findings are listed here below. In the mid and late 1800s, epidemiological methods began to be applied in the investigation of disease occurrence. In the 1930s and 40s, epidemiologists extended their methods to non-infectious disease. The period since World War II has seen an explosion in the development of research methods and the theoretical underpinnings of epidemiology. Epidemiology has been applied to the entire range of health-related outcomes, behaviors, and even knowledge and attitude. During the 1960s and early 70s, health workers applied epidemiologic methods to eradicate naturally occurring smallpox worldwide. This was an achievement of unprecedented proportions in applied epidemiology. Excuse me. In the 1980s, epidemiology was extended to the studies of injury and violence. Moving forward in time, the 1990s, the related fields of molecular and genetic epidemiology, the expansion of epidemiology to look at specific pathways, molecules, and genes that influence the risk of developing disease took root. And then again in the 1990s and accelerating after the terrorist attack of 9/11, epidemiologists have had to consider not only natural transmission of infectious organisms, but also deliberate spread through biological warfare and bioterrorism. In the present, we have Dr. Fauci, who has devoted much of his career by researching viruses and the immune system and is encouraged by the new president's approach to the COVID-19 pandemic. This is a quote from Dr. Fauci. "It was very clear what President Biden wanted, and that is that science was going to rule." Fauci goes on to say that we were going to base whatever we do on sound scientific evidence and sound scientific data. Continuing on to say that we were going to make some mistakes, we're going to stumble a bit, and when that happens, we're not going to blame anybody, we're just going to fix it. Fauci mentions that the pandemic is far from over, especially as the virus mutates and new strains emerge. The key is to, quote, vaccinate as many people as quickly and as efficiently as possible, and to double down on the public health measures of uniform wearing of masks, physical distancing, avoiding congregate settings, particularly ones indoors. He then goes on to say that you've got to be able to get the entire world vaccinated. As we allow this infection to exist in any degree in any part of the world, it will always be a threat. So we've got to approach this the way we approached smallpox, the way we approached polio, and the way that we approached measles and other devastating global outbreaks. Going on to say that we can meet the challenge, and you can meet it first by getting a handle on the degree of mutations by doing good genomic surveillance, but also by doing whatever you can to prevent the replication of the virus by vaccinating as many people as quickly and as efficiently as possible. Going on to the present, the CDC, from the beginning of the COVID-19 outbreak, Scientists at the CDC and around the world have been working to identify the source. Epidemiologists went to the area in China where the disease first appeared and conducted surveys in the community and health facilities. These field investigations showed them who was infected when they became sick and where they had just been before they got sick, and then ultimately led them to a possible source. They also moved on to continue to monitor and track the disease. The CDC does this by keeping track of the number of COVID-19 cases and collects information on the disease from surveillance systems that report different kinds of data. Currently, the CDC scientists use surveillance data, including information from antibody testing and other kinds of studies, to find out more about the disease. They also develop guidance for actions to slow its spread. Using study findings, case counts, and surveillance, CDC publishes resources to help people in different risk groups, like healthcare workers or the elderly, to stay safe in all sorts of settings. And then as a note here, we must all keep in mind that since this is a new virus, the guidance is constantly being updated as new information becomes available. The uses of epidemiology most commonly are assessing the community's health. Public health officials responsible for policy development, implementation, and evaluation to make important decisions to assess the health of a population or community, and relevant sources of data are identified and analyzed by person, place, and time. People use epidemiologic information every day to make decisions. There has been research for many years where epidemiologists collect data to determine different things like exercise and diet to help reduce the risk of heart disease, increased risk of lung cancer among smokers, increased risk of HIV infections associated with certain sexual and drug-related behaviors. These and hundreds of other epidemiologic findings are choices people make every day and how it affects their health over a lifetime. When investigating a disease outbreak, epidemiologists rely on healthcare providers and laboratorians to establish proper diagnosis of individual patients, but also rely on physicians' understanding of the clinical picture and natural history of the disease. They all collaborate to characterize different diseases by collecting individuals' data. Most epidemiologic research is devoted to searching for causal factors that influence one's risk of disease. Their goal is to identify a cause so that appropriate public health action may be taken. Epidemiology often provides enough information to support effective action. These are some investigated public health problems and events that correlate with them. I will leave this up for just a moment while I take a sip of my coffee. As you can see here, we have different types: environmental, infectious, injuries, non-infectious, natural disasters, and terrorism. And then to the right of that, there are some dates and events that correlate to those specific categories of investigation. Early on in the functions of epidemiology, they were divided into 6 major tasks to help speed up the process. There is public health surveillance, which is the systematic collection, analysis, interpretation, and dissemination of health data, which is used to guide decision-making on public health. Field investigation, in essence, is contact tracing and investigation into the reported cases and any information which can be provided, for example, contact tracing, symptom analysis, and reported conditions. Analytic studies follows 4 processes: design, conduct, analysis, and interpretation. The evaluation stage measures effectiveness and efficiency, effectiveness of the ability to produce expected results, and efficiency of those results without expending massive resources and time. The linkages stage is the stage of which other agencies work together to combine opinion and collaborate on future endeavors. And then finally, policy development, which is the stage which epidemiologists who have worked and dealt in with crisis provide input and testimony on future disease control strategies and regulation. Epidemiology as it relates to COVID-19 and its core functions. COVID-19 receives the same treatment as many major diseases since the founding of epidemiology. Scientists and health experts gather to study disease, communicate with local experts, and make efforts to slow the spread. These steps are identify the source of the outbreak, monitor and track the disease, study the disease and develop vaccine and treatment guidance, and then develop action guidance. COVID-19 experts visited China when the outbreak began to immediately begin work on breaking down the genome of COVID-19. From there, they started contact tracing and documenting the illness and how it's affecting those who contracted. Once they had an idea as to how it spread, they continue with guidance and contact tracing to stop the spread. The epidemiologic approach, in the most simplistic terms, does three things: counts cases or health events and describes them in terms of time, place, and person, divides the number of cases by an appropriate denominator to calculate rates, and compares these rates over time for different groups of people. Before they can gather a data set, the scientists must identify what will qualify as a case. To define a case, we must first create a case definition, collect information on patients that fit that definition, characterize cases by time, place, and person, and then identify a disease rate. The COVID-19 case definition from the CDC identifies some basic aspects of the disease that set it apart to identify and study it as a separate entity from other illnesses, such as the clinical criteria, which includes symptoms, the laboratory criteria, which is confirmatory lab evidence, presumptive lab evidence, supportive lab evidence, and then the epidemiologic linkage criteria to distinguish new cases from existing cases. The classification is separated between suspect, probable, and confirmed. Here is a list of our references, and thank you for watching our presentation.